Good morning. Welcome back to Open Med School. I am Dr. Andrews, Professor of Medicine. Today I am going to discuss with you a very common problem, fever. This is part of CBME Internal Medicine 3.4 and 3.5. Let us see what is fever. Fever is elevation in body temperature above the normal circadian range as a result of the change in the thermoregulatory center, which is located in the hypothalamus and preoptic area. So basically, fever is due to elevation of the set point of the thermostat. So when thermostat is at a higher level, the body generates heat, and that is fever. So this has to be distinguished from hyperthermia. In hyperthermia, thermostat is not elevated, set point is not elevated, but the temperature is increasing due to problems in the dissipation of the heat. So that is the basic difference between fever and hyperthermia. Hope it's clear. Now we look into the thermoregulation. How the temperature is generated. It is mainly by the basal metabolic activity and the muscle contraction. So all are aware, when you develop fever, you get rigor and chills. So this rigor is increased muscle activity in order to generate heat when the thermostat is at a higher level. So when there is a sudden change in the thermostat, you get rigor and chills. So heat is lost by conduction, convection, and evaporation is a very important mechanism by which heat is removed from the body. So as we are aware, the sweating starts when the environmental temperature is high, or when you develop fever, you can have increased sweating. And temperature is regulated by hypothalamus. The set point is usually 37 plus minus 0.5. So the normal temperature is usually, many books give little different values, but approximately you can remember 37 plus minus 0.5. So it is easy to remember. And why this temperature? Because the normal function of many enzymes and metabolic process, this temperature is the optimal one. So the temperature has got a circadian rhythm that we already mentioned. So approximately 0.5 degree elevation is seen in the evening. So less temperature in the morning and more temperature in the evening, approximately 0.5. But the body cannot identify rise in temperature of 0.5 degree. Approximately 1 degree centigrade rise is required. Then only we can appreciate fever. That is why the low grade fevers are predominantly felt in the evening. That is, we usually say that tuberculosis, the evening rise of temperature. This is because in the morning, even though patient has got a mild fever, example approximately 0.5 degrees, it is not appreciated. But in the evening, already there is a circadian change. Evening temperature is high, 0.5, plus the fever of 0.5 added together, it exceeds 1 degree, and then you feel fever. So low grade fever is usually present with the evening rise of temperature. Now we go into how the febrile response occurs, how the fever is initiated. This is by exogenous or endogenous stimuli. These exogenous or endogenous stimulus are presented to the host cell. Principally, the host cells are monocytes and macrophages, and they synthesize various cytokines, which are pyrogens, or pyrogenic cytokines are produced. Which are the important cytokines which produce fever? Interleukin 1, interleukin 6, TNF-α. These are the major cytokines. Among this TNF-α is the most potent, and interleukin 6 is the least potent endogenous cytokines. What are the exogenous things? Exogenous stimuli means the stimulus is from outside the host. They are maybe microorganisms, they are products or toxins. They are called endotoxins. Classical example is a gram-negative bacteria which has got a lipopolysaccharide. And this is a classical example of a endogenous or not endogenous, endotoxin, and is usually present in the outer membrane of the gram-negative organisms. So gram-negative organisms, when they produce infection, this LPS, lipopolysaccharide, will act as a endotoxin. Hope this point is clear. And this endotoxin, how they produce fever? This endotoxin will act either directly at the brain, that is hypothalamus, to produce fever, or through monocytes and macrophages. Then the cytokines are produced. So 2 ways the endotoxins can produce. Example is a classical example is the lipopolysaccharide antigens. So we have understood the mechanism of production of fever. That is, it can be exogenous and endogenous substances. And the cytokines we have studied, the major cytokines are TNF-α, interleukin 1, interleukin 6. Now we go into the mechanism how this cytokines produces. The cytokine will interact with the receptors. The receptor is situated in the preoptic region of the anterior hypothalamus, and it activates an enzyme phospholipase A. So this phospholipase A liberates plasma membrane arachidonic acid, and this is a substrate for cyclooxygenase pathway and result in the mediator prostaglandin E2, and this modifies the thermosensitive neurons in the thermoregulatory center. So the mechanism is, that is why the cyclooxygenase inhibitors decrease the fever. So I'll repeat, this cytokines, that is TNF-α, interleukin 6, interleukin 1, they interact with the receptors in the preoptic region of the anterior hypothalamus, activate phospholipase A. Phospholipase liberates arachidonic acid from the plasma membrane, and this arachidonic acid is a substrate for the cyclooxygenase pathway. Cyclooxygenase pathway produces prostaglandin E2, and this is responsible for the changes in the thermosensitive neurons of the thermoregulatory center or the thermostat. It will produces the fever. So there is some difference between the rectal temperature and the oral temperature. So usually the rectal temperature is approximately 0.5 to 0.6 degree greater than the oral temperature. And I already mentioned the morning temperature is comparatively less, approximately 0.5 degree difference. The AM temperature is usually around 37.2 degrees centigrade in the morning, and the PM temperature is 37.7. That is, the diurnal variation is approximately 0.5 degree, but this is not appreciable by the normally. Now we go into what are the presentations of fever, or when you get fever, all of are aware you will feel hot. That is, even when second, there is chills and rigor. Chills is different from rigor. Chills is the chilly sensation, you feel cold. Rigor is the muscle contraction. You may get the chattering of the teeth, shivering, and this means there is a rapid generation of heat. The thermostat is kept at a higher point and body wants to generate heat. And there are certain fevers which are notorious to produce fever with rigor and chills. Typical example is malaria, patients with urinary tract infection, especially pyelonephritis, sepsis and abscess, especially liver abscess, cholecystitis. These are common conditions. Then pneumonia, especially pneumococcal pneumonia, they comes with the rigor and chills. Then malignancies like lymphoma. These are some of the common diseases that presents with the rigors and chills. Again, remember irrational use of antipyretics. That is, you give the paracetamol or some antipyretics for SOS use whenever there is fever. Then what will happen? The thermostat will be kept down, and once the action of the paracetamol is gone or the antipyretics is known, the patient can develop again rigors and chills. That is why the management usually, if you are giving antipyretics, you give it round the clock. That is, every 6 hours or every 4th hourly. So the presentation we have mentioned about the feeling hot, second chills and rigor, third important symptom we are very familiar, you can get headache, a throbbing type of headache. So, but very severe headache and photophobia, this suggests meningitis. But even without meningitis, that inflammation of meninges or brain, you can get headache. Alteration sensorium, this is called a delirium. Mental confusion can occur in fever, especially in the young and old. That is, extremes of age, fever can produce changes in the sensorium. It's called delirium. Muscle pain, aches and pain, myalgia is characteristic. This can occur in any fever, but as in viral infections like influenza, there can be inflammation, there can be myositis also. So viral infections predominantly produces, again here remember the dengue fever. Here is mainly bone pain and joint pain, but muscle pain can occur in many viral disease and also in malaria, brucellosis, etc. Then there's a terminology hyperthermia, which I already mentioned. Hyperthermia is different from fever. In hyperthermia, the hypothalamic set point is not elevated. So this hyperthermia occurs when there is a inadequate heat loss. That is, body is unable to release the heat from the body. The sweating mechanisms affected, you can get. Example is a heat stroke. When somebody is exposed, then we'll just think what is the reason for fever. Elevation body temperature increases the chance of survival because temperature increases the phagocytic activity and bacterial cell activities of neutrophils. And the cytotoxic effects of lymphocytes are also improved. So the fever is a beneficial thing, and that is why unless it is a high temperature, there is no need to start antibiotics. Now we go into what are the patterns of fever. The important patterns you should remember is the intermittent fever, remittent fever, continued fever. Another sometimes we call is a hectic fever, relapsing fever or periodic fever, stepladder fever. These are some of the patterns. In the next session we will discuss about the patterns of fever.